Good morning, and thanks for joining us here on The Real Story. I'm Emma Wulfhorst. Healthcare costs are one of the biggest concerns for Connecticut residents. The prices of prescription drugs to medical supplies and insurance coverage continue to rise. Now, Connecticut patients and healthcare companies alike are trying to find relief. Joining me now to discuss this is John Driscoll, board chair of UConn Health and Governor Ned Lamont's new healthcare advisor. John, thanks so much for being here.
Delighted to be here.
So you took over the role of UConn Health Board Chair in December. It's only been about 2 to 3 months, but what was top of that to-do list when you stepped into this position? What did you want to hit the ground running on?
Well, I think one of the great things about the UConn health system is it's probably the best kept healthcare secret in the state. We're the fastest growing healthcare system. We have one of the best patient safety records and one of the best patient experience records in the country. And I think what I'm really excited about is to make sure first that people understand that, and second that we take advantage of the growth we've had to turn around the deficit we've had and actually get to the point where we can contribute more back to the state than we rely on. And finally, to see if we can play a bigger role in the mission of really serving the vulnerable communities, the most vulnerable communities that we care for. I mean, 1 out of every 4 people we care for is on Medicaid. And I just am really excited to draw attention to the UConn health system and then see if we can really extend its reach and improve and extend the mandate we have to care for the state's most vulnerable.
Absolutely. We know access is really one of those biggest points. What are you seeing right now, in addition to access, as some of the biggest problems? What's the state of healthcare right now in Connecticut?
Well, I think that the general rate of quality is fine, but I think all of us are struggling with extending primary care access and making sure we continue to do a better job to care for the state's most vulnerable population. The second thing we have to take a look at is whether we're getting the best deals we can, either from managed care in terms of compensation to hospitals and doctors, and in prescription drugs. I think we have to continue to look at new ways to access, to reverse or at least manage the unsustainable trend of the increasing cost of purchasing basic drugs that are extending life, but only if we can afford them. And those are the things that I'm thinking about and working on with the governor and with the teams in social services and healthcare strategy.
Right, and I do want to get more into the prescription drug costs, but as you just mentioned there, you have another role. So first, walk me through, what does being healthcare advisor to the governor actually mean? What's your role?
Well, I think as a practical matter, what Ned has done, what the governor's done, is really bring in a lot of really talented people, whether it's in the Department of Economic Development or social services or healthcare strategy. I think what I bring is a combination of managed care, prescription drug, healthcare technology from the private sector. And I think our goal is to try to match some of my talents and insights with the passion and the competence of the leaders we've got in all the different areas right now to see whether we can accelerate the changes we want to see to improve access, improve care, and lower the cost of care in the state of Connecticut. It's really I guess, trying to bring my private sector experience and my public sector passion together with the talent we've already got on the ground. We've got some of the smartest people in healthcare in the country in Connecticut, but they're not always aligned around or engaged. And one of the great things about Governor Lamont is he wants to bring the best talents of the state to apply to some of the biggest problems in the state. And I'm just lucky to kind of work with some of the commissioners, with the team at UConn Health, with Andy, our great CEO, to try to solve some of these problems.
And the governor actually called you out, mentioned your name in his State of the State address at the start of the legislative session back in January. I want to quickly play a clip of that. Let's take a listen to what the governor said.
Pharma costs have increased dramatically as a share of our healthcare spend, and costs of hospital services have also continued to rise. We have a kitchen cabinet that's working on affordability right now. That's Deirdre, that's Claudio, that's Andrea, that's Sean, that's John Driscoll. We have an open door at a big table. Come in, give us your constructive suggestions. We got to get this under control.
And in that clip there, Lamont is highlighting pharma and hospital costs, which you mentioned. As we've been talking about, prescription prices are a big concern for residents. Can you tell me a little bit more about what your work with the governor looks like specifically when it comes to combating those prescription drug costs?
Well, I think in terms of prescription drug costs, we really have to look a lot more carefully at the kinds of deals we're getting, prescription benefit managers, the kinds of deals we're getting from pharma. The reality is that a lot of members of the traditional pharmaceutical companies and a lot of particularly the third-party prescription benefit managers are taking advantage of the fact that there isn't enough transparency around purchasing and pricing. And that's resulted in costs going up for consumers and it being harder and harder for community-based pharmacists to even survive. And so what I'd like to do is to review whether we're getting the state of Connecticut, starting with the UConn health system, working with the Commissioner of Social Service to see whether we're getting a fair deal on the fairest deal in purchasing drugs. And I'm working with Comptroller Scanlon, with all of the members of the team to see, are there ways that we can unpack and take advantage of what some of the other states have done. The state of Ohio has been very aggressive at going at taking those costs out and purchasing directly. Other states have figured out how to engage folks like Mark Cuban's Cost Plus Pharmacy with their employees.
Right.
So I think all bets are on the table. We want to make sure people get access to drugs in the state of Connecticut, whether you're in a state program or you're purchasing as an employer at the best deals possible.
And so with that, when it comes to purchasing, the governor mentioned in his State of the State and also introduced as his own legislative package proposal, opening up a pathway for the state to purchase and import prescription drugs from Canada. Do you see that as part of this solution as well?
I think everything has to be on the table.
Okay.
And so I don't think there's an enormous amount of excess supply in Canada, but if there's supply at a better price from a trusted exporter, we should take advantage of that. I mean, the reality is prescription drug costs have gone from costing about 6% of total healthcare cost to more than 20% of healthcare costs. Wow. And these are life-saving drugs. In some cases, they're transformational drugs that can do things like turn cancer from a critical diagnosis to a manageable disease. We want to maintain access to those, but we shouldn't be paying an extortionate price. And in too many cases, we see I've seen the prices in the private sector distorted by middlemen. And in some cases, those distortion and that lack of transparency taken advantage by members of Big Pharma. And it doesn't make any sense when we've got patients who can't afford their pills and pharmacists who can't afford to prescribe them. Yeah. There are solutions out there. We just have to come together and make sure that Connecticut's getting the best deal.
And as we discuss those proposals and what's happening here at a state level, a lot of this I've heard from the governor's office as well as state lawmakers is a response to what's happening nationally and globally. RFK Jr. recently sworn in as the next Health and Human Services Secretary. I've heard a lot of concerns about the impact of some of his policies and procedures he wants to implement. And with all of this discussion and misinformation about vaccines, we just saw the first measles death in the growing outbreak in West Texas this past week, an unvaccinated child. What are the effects of some of these federal politics and this current administration on healthcare here in Connecticut?
Well, I think the biggest threat that RFK and some of the teams around him is continuing the extension of sort of undermining the trust of caregivers, of doctors, of hospitals, and of public health officials. And one of the great things about this state is I don't think it's affected the state of Connecticut, but we have to worry about that. I think that, vaccines and biopharmaceutical research to turn it around, it's the investment in the biopharmaceutical sector and in vaccines that has helped us extend life in this century by nearly 20 years. For centuries, humans had a very fixed lifespan. That basically doubled because of clean water and antibiotics, and it's been increased by another 30% because of the interventions of the drugs and the vaccines largely, that have helped protect us from manageable disease.
Right.
And we can't undermine that trust. So that's point number one. Point number two is I do think the Republican legislator is very clear. They're coming for Medicaid. And we have to do everything we can to protect this program that protects the most vulnerable. You know, the Medicaid system nationally and in Connecticut, you know, it's nearly 50% of all babies born are born on Medicaid, and 60% of all the elderly in nursing homes are on Medicaid. This is a program that protects society's most vulnerable, and it's a massively important, the federal government's a massively important partner for the state of Connecticut. We have to fight and protect that program that ultimately protects the most vulnerable people in our society.
Well, John, thank you so much for taking the time to check in with us. Unfortunately, that's all the time we have, but I'm sure we'll be checking back in with you as the session progresses. Thanks again.
Thanks, Emma.
Still to come here, though, on The Real Story, as we said, the legislative session now in full swing with committee meetings, public hearings, and even some floor sessions. We're taking a look at some of the proposed measures from possible constitutional amendments to protecting reproductive rights. That's ahead. Stay with us.